And now Laura Windsor has this interesting report on health and wellness for kids.
As parents, we are always concerned about our children's well-being, but are too many activities and not enough family time causing your child to become too stressed? Dr. Julie Reeker of Children's Hospital of Orange County gives us her advice on what parents can do to help promote health and wellness for their children.
Kids have stress for a lot of different reasons. One thing is exactly that they model their stress from their parents. So if the parents are having a stressful lifestyle, they're watching and observing and a part of that stressful environment. So if there is conflict going in a family, if there's lots of activities, if there is a heavy commute and long hours, the family doesn't get to eat dinner together, that actually does have an accumulative effect on the child and is stressful. Kids need routine, need to feel that there is a regular schedule and that they're going to count on that. And they need downtime too. So if they're too rushed or have too many different things going on, too many activities planned, that actually is stressful. For kids, their school and their friends and their play is their work. And if they're overextended and have too many things going on, just like we get stressed if we have too many things going on, they do too. For children, I think they show stress in different ways. So I think for adults, we're more likely to show emotional distress through showing our emotions. So maybe we're going to cry, maybe we're going to be irritable with our spouse, maybe we're going to yell at the kids or be impatient with the dog. And certainly you can see that in children as well. They may be fairly verbal and be able to express themselves and tell you, but probably more commonly what you'll see for a child who's stressed out is more of a behavioral presentation. So maybe hitting, maybe certainly being irritable, maybe being a little bit argumentative with their siblings or having fights at school. But you can also see it in physical ways as well. So that's true actually for adults as well, but maybe stomach aches or maybe trouble sleeping or headaches. And so we have to watch out for those sort of more subtle signs and kind of realize that particularly a younger child isn't necessarily going to be aware that that's what stress is or that they do feel stressed. And so be definitely watching out for their behavior and then also just how if they're physically complaining of different kinds of things like stomach aches. We can help them in a lot of different ways. I think the most important thing is to definitely have some downtime, some one-on-one time where you're just kind of checking in with your child and kind of finding out how did it go today at school, how are things going. Some kids are pretty good about if you really take some quiet time with them, and especially like one-on-one time, maybe at night with a bedtime routine or part of a family dinner, that they really can tell you, yeah, somebody was picking on me at school today, or I really am nervous about that test. But not every child necessarily is going to be able to verbally express themselves in that way. And so kind of be in tune with what your child's temperament is. Some kids are going to want to de-stress by being creative and doing some artwork, or they might be somebody who likes to do something a little bit more physical, like play basketball or run or walk with the family. And so I think the most important thing for parents to realize is what is their own stress level and what is their own way that they handle their stress, but then also be aware that maybe their child's personality or temperament is going to be a little bit different from theirs. So it's important for the parents to be aware of what their child's stress level is, but certainly there can be extraordinary circumstances where the family's stress or the child's stress exceeds sort of what the parents can do. So as soon as the parents have done sort of those first steps, establish a routine, make sure they're checking in with their child, giving them examples of how they can de-stress. But sometimes in the case of maybe a family divorce or a death in the family or maybe an illness in the family, that child's level of coping, or the stress they're under is exceeding their level of coping or the family's coping. And maybe they do need a little bit of extra support or help. And so sometimes you can reach out to a school counselor, it can be a spiritual counselor through your church, or through a psychology department, a community mental health center such as CHOC, and there are psychologists and social workers here available to help you and to learn some better stress management and coping techniques, not just for the child, but for the whole family.
Getting together for family meals and just talking with your children can make a big difference in their life and yours. I'm Laura Windsor for the American Health Journal.